Now let's see one case why CBC parameters are so important. So a young boy, he's B chemical, he came to Bombay for job. So in that medical examination done and CBC advised. So he came to Nanavati hospital lab and then CBC is done. So in that the first CBC count, that is the total WBC count, was 74,000 cells per cubic millimeter. Then peripheral blood smear report done, and in that many blast cells seen. So bone marrow aspiration and bone marrow biopsy advised, and it is done. And the person diagnosed as AML, that is acute myeloid leukemia. Then few cycles of chemotherapy given. Then because he was very young, so bone marrow transplantation advised. So he has six brothers. So one brother's bone marrow matched and then transplantation done at Tata Hospital. After few months, he came to Nanavati Hospital again for the CBC investigation, and that time it was a normal report. So because of the CBC, the person got diagnosed AML earlier, and then he got treatment earlier and then early cure. That is why CBC is very important. So in CBC, what are the CBC parameters? So it is hemoglobin, total RBC count, total platelet count, total WBC count, then differential leukocyte counts. In that we can see A granulocytes like lymphocytes, monocytes, and granulocytes like neutrophil, eosinophil, and basophil. And RBC indices, in that PCV, MCV, MCH, MCHC, and RDW can be seen. So all these parameters we can do manually, but because of the calculations it takes longer time. So nowadays, because of the advanced automated cell counter system, we can do all these parameters within a minute in one aspiration in the cell counter. So definition of leukemia. So this is abnormal proliferation of the hemopoietic cells, that is abnormally hemopoietic cells, that is precursors of the RBCs, WBCs, and platelets, that is the immature forms of all these blood cells. They are abnormally increased, and then because of that they infiltrate into the bone marrow, and then the process of differentiation in leukemic cells is often abnormal and is commonly result in immature morphological appearance. So they are also called as blast and the other forms of the immature cells. So that abnormal proliferation of the hemopoietic cells is called as leukemia. Now we will see etiology. So what is the reason for that? So it can be seen because of the alteration of structure of DNA in the nucleus, and then chromosomal abnormalities like very common in leukemia, and then because of the radiation or chemicals like benzene, so people working in benzene factory, or few viruses which are causing this leukemia, and then some genetic factors are there. So these are all the etiological factors which are responsible for the leukemia. So clinically, patient is presenting with acute leukemia. So most common symptoms are anemia, fever, malaise, bleeding, that is hemorrhage, bruising, pateki. So bleeding can be from the gum or from the nose or from the skin. Then less common symptoms are infection of the mouth, pharynx, pain in bone and joints, mainly in childhood, upper respiratory tract infection, mainly in childhood. Thank you.